The back to school facelift is one of the specials that we're running. It has 3 or 4 different components. It has a little bit of Botox. It has a little bit of a filler. Then it has an infusion, and then it has a little bit of ultrasound treatment, which is a skin tightening treatment that I do to tighten and lift. So certain areas of your brow, certain areas of your jowls that may need, or under the chin tightening. So that is something that we do for the face. So it's like a non-surgical refresh. Hello. How is everyone? This is Dr. Din, and today our topic of discussion is going to be a very important thing, such as a facelift. We're going to be talking about back to school facelift. Don't let anybody, especially people who you're trying to avoid, find out how crazy your kids drove you this summer. And one good way to hide that is to come for a back to school facelift. Now, back to school facelift is non-surgical. So back to school facelift is for those people who have kids who are going back to school. So when you're in that stage where you love your kids, listen, we all love our kids. We'll give anything for them. But is it hard work? Raising your children is hard work. And they do take so much out of you. So one of the ways to rejuvenate yourself after a long, wonderful summer is to come to a space like Giovanni. And what we do over here is we rejuvenate you and refresh you and bring back the pizzazz that you may have lost while you were taking care of your family, especially your little children during the summer. Yes, you're right. Listen, there are filters that are placed on top of your skin, and there are filters that are placed under your skin. And makeup is nothing but a kind of filter. And we are all for filters. Filter yourself, please. Put the filter on. Put the filter inside you and outside you. Anyway, so guys, today we're going to be talking, if you are interested, so the only people who should listen to this are mothers, young mothers, and mothers who are interested in finding out how they can stay connected with their beauty for a lot longer. Because remember, everybody is pretty for 5 seconds in their life. Maybe it could be 5 months. Maybe it is 5 years even. But yes, in your 20s, sometimes in your 30s, before you have several children, 1 or 2 children, the 30s are a time of the maximum flux in a woman's life. That's the time when career is happening to you, when marriage and relationships are happening to you, when children are happening to you, your body is expanding and contracting and expanding and contracting, and your hormones are going up and down and up and down. And in between of all that flux of relationships with your children, with your spouse, with your boyfriend, with your whoever, with your parents, and with your, if you are a working lady, then also at your work. So 30s are a time when women tend to peak, and that's also the time when they undergo the maximum amount of pressure. So that's the time when you are beautiful and when you achieve the best of the best for a little while, and then it is all downhill after that. So that's when perimenopause starts to happen, because that's the nature of your stay in your body. So at some point, when you're in your 30s and when you've achieved your peak, you may want to stay connected with that perception of beauty when you're at your peak. And that's the purpose of somebody like a wellness doctor, like an anti-aging doctor, where you would want to find somebody like me. So one of the things that I always say is that after summer, especially if you have young children, you may want to refresh yourself at the end of the time when you were the only person available for your children. And back to school facelift is for those people. And what do we do over there? We give you certain medications, because for the first time in human history, now what we have access to is some medications and some energy devices that can bring your skin back in time. So we basically bring you back in time. So there may be time travel. Time traveling is possible for your skin, because you can meet the younger versions of your skin with the use of some medications and some energy devices, which are now FDA approved. And we have been using them for the past 15 to 20 years. How does pregnancy affect the overall elasticity of the skin? So pregnancy is a great experience. That's the time when a female's body is able to create a new life and bring a new life into this world. However, the process of creation takes a lot out of her own body. She expands, first of all, and then she has to contract. And usually when you contract, you do sometimes come back to your original size, but mostly women don't. And it takes them like a couple of years of hard work to get back to their original self again. And then most women want to have like a couple of children. So they need, because you're also, when you're in your 30s or in your late 20s, your time when you can have normal births, it's like, coming to a close. So you have to do it quickly, right one after the other. And that's why it is super important to take care of yourself in between the children. So yes, overall elasticity is compromised, but because you're young, your skin is capable of healing itself. So you won't need, like really surgical procedures or surgical grade procedures to get back your old self. So yeah, that's a great question. But yes, elasticity may be compromised, but there are ways to regain your elasticity. What are the areas of the face that can be treated with a non-surgical facelift? So non-surgical facelift is basically can happen anywhere. So every face is super unique. So if you are in your 30s, you may start experiencing some sagging around the upper face, some sagging around the lower face also. So what we do is we offer you some medications like a little bit of Botox, which is a modulator, which basically relaxes the muscle so that your muscle doesn't scrunch so much and create more collagen loss. And usually we don't like to relax your muscle on the lower part of your face. So what we like to do in the lower part of the face is, like, if you've lost some collagen over there and some elasticity over there, we end up injecting some collagen back into your face also. And one of the very important things that I like to do is to tighten the skin. So one of the things that, if you're in your 30s and 20s and 30s, one of the things you may want to explore is like skin tightening and firming it up. And there are some supplements that women like to use, and which are very good for not only your skin but also your hair. And hair loss is a sign of skin aging. Whenever your skin ages in an accelerated way, one of the earliest signs of skin aging is hair loss. And if you're somebody who's experiencing hair loss, the easiest way to stop your hair loss is to supplement yourself with the appropriate nutrients and minerals that your hair totally requires. which also is something that we do in our office. Are there any changes in skin texture or tone that are unique to pregnancy? So during pregnancy, you have your skin is exposed to a lot of different hormones. And yes, during pregnancy, your skin will be great because it will stretch, it will be nice and moist. A lot of women feel really great during pregnancy. But what happens is that after pregnancy, all those hormones drop down, and that's when you suffer from a lackluster, because it's like it takes a lot out of you. And that's when we also want you to take a lot of supplements and protein and nourish yourself so that you can enjoy getting connected to your beauty again. Non-surgical facelift. So non-surgical facelift is for not just the problem areas for your face. So not, for example, a lot of people have eyebrow lift, and they want that the sagging of the upper face should be reduced. So we do some injectables over there. And then we also have like skin tightening treatments for the under chin, for jawline, areas where you may be experiencing some laxity. Because remember, sags and drags can cause you to disconnect with your beauty. So one of the very important things that I also like to talk about is hair care. So hair is a very, very important part of your skin. Your hair is basically an extension of your skin. And one of the things that women always have trouble with is hair loss. Sometimes you lose hair after giving birth to a child. Sometimes you lose hair when you're in perimenopause. Sometimes you lose hair if you've had rapid changes in weight. For example, if you were doing some fad diet that's causing problems, like it may reduce your size, but the next thing you see is that your skin is like looking older and you're definitely losing hair. Sometimes if you have been ill, for example, if you went through the pandemic, and so many people who got COVID again and again lost a lot of hair, and they could never regain the hair loss. And that is something that we help you fix with the help of supplements. So hydration, supplements. And supplements are, not all supplements were created equal. And sometimes the best of the supplements, you could be taking the best of the supplements, but you may be taking them the wrong way. So supplements are water soluble and fat soluble. And please, you're most welcome to join my class where I teach about which supplement should be taken in what way. Because you may be taking 20 supplements, but if 15 of them need to be injected into your vein for them to get to your hair and your skin, taking them orally may not work. And if you are placing a supplement that should be taken orally and you put it in your vein or you put it in your muscle as an intramuscular injection, it may not work as well also. I see a lot of people who take vitamin D supplements as an injectable, and it's like a heavy dose of vitamin D that they would put in their muscle, and they think that that's going to fix their vitamin D problem. Meanwhile, it doesn't, because vitamin D is a hormone. It's like a hormone that you place, so you cannot overdose on that. And for you to become deficient in a certain mineral, it may have taken years before you became that deficient. So you will not be able to fill it back again in overnight. So those are the supplements are a science in itself. And that's why you need to find a provider, or who could be a doctor, who could be a nurse. There are like a lot of good nurses who are these days providing really good supplements and access to supplements for people. So supplements is like our next horizon of growth. And that's something that, doctors are very quickly getting into. So find a doctor near you who does supplements so that you can find the best supplements for your body. What is the secret to me having long hair? So growing a hair is, this takes a lot of work. This is a lot of work, and this is a lot of supplements and minerals that I have poured into my system, and that's why this is real. And again, one of the ways I actually tell people that this is not free, and especially when you're in postmenopausal states, it's very hard to grow very long hair. So if you find somebody who's in their 50s or 60s with really long hair, and those are actually their own hair, they're not using extensions and bullshit, then yes, then you have to know that that is something that, even if it is genetics, like genetically you could have great hair. However, genetics will only take you so far. And after that, science and some money will take you farther. So the Birkins and the Louis Vuittons of our age is not the leather bag. It is the real body parts that you still possess and grow. So the secret to my long hair are the supplements that I give to myself. And I give to myself, my supplements are monthly. I don't know about you guys, but I recommend supplements monthly. Especially if you love your hair, if you care about your hair, you need these supplements monthly. How do lifestyle factors like diet and stress impact hair restoration? So yes, so if you are on a fad diet, like I hear girls go on juicing, and then next thing they know is 2 months later, 3 months later, they have like clumps of hair falling out, and they can't make up. At that point, by the time their hair starts falling, they can't figure out what was it that led to it. And it was probably the fact that they deprived their body from protein so much and so quickly that they ended up with hair loss. And yeah, so a lot of things can impact your hair. Your hair is a very fragile thing. It's also very strong. The reason you want good quality hair is because hair is that part of your skin which allows you to gather the energy of sun. So if you have long hair and it's also healthy and you go out in the sun, it very quickly gets all the energy of the light, and it will keep supplying that energy and that charge to your body for the whole day, and you have to do it again. What type of vitamins are needed to improve the appearance and health of hair? So so first of all, you should have like all the B vitamins. So whether it's B12, B6, B complex, all those B vitamins, and plus I like to give glutathione for your hair, because glutathione is like amazing for your hair, and it gives you like a good growth spurt. At my office, if you have hair loss secondary to perimenopause or menopause, what I like to offer to you is like a series of infusions of different minerals and nutrients intravenously. Try to do them once a month, and try to do them for a year or two if you want like longer hair. And if that alone does not fix it, we do expect you to also be eating a wholesome diet, so you're not getting all your protein and everything. So, and we want you to be not deficient in vitamin D. And we also want to make sure that all your hormones are working fine. So we do ask you to do your blood work and show us. And then the other thing that I recommend is a laser. So if these basic adjustments in your life and supplements do not cut it, then we bring you to step 2, which is a laser treatment. So laser treatment for hair restoration is super cool. It is like a radio frequency laser which has micro needles that can go a certain depth under your scalp to basically resuscitate the dying hair follicle. So your hair follicle could be dying because it just can't get the resources to grow. Because growing hair is like growing a plant, growing grass. It's like very hard. So if the follicle does not find food and nourishment around, it's gonna die of starvation. So sometimes because your scalp is a thick area, sometimes the follicle, as you get older and the scalp hardens, it just can't access the nutrients. So what we do is that we try to give it to you intravenously, so to make sure that the access is available. But sometimes the scalp is so thick and it's very hard for the hydration and minerals to get all the way to it. So what we do is that we give it access by giving a microneedling treatment into your scalp, which will create the channels for your follicles to gain access to the minerals and nutrients that we have been providing you. And with my laser, what it also has is that the microneedles, that the channels that are created are also perfused with a radio frequency energy. And that energy is basically given into those channels to resuscitate the dying follicle. So what it does is that we basically every 6 weeks give radio frequency energy to that same area to see like if there is any growth, if there is any follicles left. Now, if you are one of those unlucky people who have not only lost the hair, but the little tiny follicles that you still have in your scalp are also dead, then you'll have to go and do a hair transplant. Now, hair transplant is like another thing. And listen, hair can be transplanted just like any other organ can be transplanted. Your heart can be transplanted, your kidneys can be transplanted. Similarly, you can also get hair transplants on your head. And the hair transplant can be taken from your own hair follicles, or we can even borrow follicles from someone else and put it on your hair. Now, once you transplant the follicles, even then you need to continue to give them the nourishment of the nutrients and minerals and vitamins and protein and all the other good things that we make the dish for your hair to get to it. So that is something that you'll still need even after a transplant, because remember, just like any other transplant, your hair transplant can because mostly people don't listen to suggestions. They have to go through that experience to figure out how to stop their problems. And one of the things that they find out experientially is that their transplant failed because they didn't do all the things that were required to keep that transplant going. And one of the things that we also recommend with your transplant is platelet-rich plasma. So we basically take your blood, we spin it, we take the nutritious part of your blood and place it into which is in the plasma, which carries all the growth factors and interleukins and stem cells. We put it back into your hair, into your scalp, so that the nourishment continues. So we basically want you to maintain that too. So those are the different protocols that are available and to all our clients. But the way we set it up for you is going to be dependent upon what is the nature of your hair loss. And everybody is different. And this is something that you don't just do 2-3 sessions and then it's over. If hair loss is your problem, then and you love your hair and you want that, then it is worth it for you to try and keep it. How many microneedling sessions are usually needed to see noticeable results on hair restoration? It differs. At least I would say, if hair loss is your problem, if you do not have hair and you've lost a lot of your hair, then I would say at least do 4. But if you have a little bit of thinning and stuff, then I would say just every 6 months give yourself like a little nourishment with the microneedling treatment. Once or twice. It's age and stage of hair loss. The back to school facelift is one of the specials that we're running. It has 3 or 4 different components. It has a little bit of Botox, it has a little bit of a filler, then it has an infusion, and then it has a little bit of ultrasound treatment, which is a skin tightening treatment that I do to tighten and lift. So certain areas of your brow, certain areas of your jowls that may need, or under the chin tightening. So that is something that we do for the face. So it's like a non-surgical refresh. So there is no cutting, there is no downtime. At the most, you might like have a little tiny bruise, which you can easily cover up with makeup. But it will just bring you back in time. It will bring your skin back. Because remember, time travel is possible for your skin. And time traveling for your skin is via the anti-aging medications and anti-aging machines that if you're in the United States, these are super important. They're FDA approved. We have been using them for at least 12 years just here in this office. And they're very, very useful. They will allow you to stay connected with the beauty of the perception of your own self for a very, very long time. This is the first time in human history that we have been able to slow time for the disintegration of your skin. So basically, this is one amazing way. It's completely backed by science, and millions of people have done it. And if you go and find the right tailor for your body, for your sensibility, then never let them go. What we will need in our future for skin, and listen, skin is the largest organ of your body. Skin is not just the largest organ of your body. It is a very, very important organ in perception of self. And as you go through time, and as you go through gravity, and as you go through hormonal changes and ups and downs, it loses its pizzazz, it loses its riz, and then we have to connect you back to older versions of yourself, prior versions of yourself. And listen, if you take care of your skin, it will have a positive impact on your psyche. Because remember, when your skin disintegrates, it does impact your brain. What are the most popular non-surgical facelift procedures currently available? So skin is like a fabric. It is the most expensive fabric that you will ever possess, and it carries your consciousness. It holds your consciousness through time, and when it disintegrates, it's over for you. So there are several ways, because remember, your skin is going to fail also as you go through time. So chronic skin failure is prevented with some of these machines and these energy devices that are FDA cleared now for use in United States. We do offer, and these devices are different for every age group. So when you're in your 20s and 30s, you may be a good candidate for something like microneedling, for something like radio frequency lasers and stuff. When you are in your 30s and 40s, that's when you need like some ultrasound devices like Ultherapy, like soft wave. These are some devices that are FDA approved now in United States too, and we have been using them. At some point, we also recommend PDO threads. Again, you have to find a really experienced tailor when you go for anything that is injectable, because you don't want to turn yourself into a clown, or you don't want to botch yourself. So make sure that whoever touches you or works with your skin is fully and properly trained, and hopefully is a licensed professional in whatever country you live in. But if you're in the United States, I would recommend to go to a doctor who has experience and has the both certifications. But yes, there are several. Ultherapy is basically a sound treatment. It's a frequency of sound that we place under the skin, and what it does is that it brings your skin back to life. So it prevents the chronic skin failure that's happening every year in your skin. And that's the reason that your skin, because it grows all your life, at some point it just can't hold all that growth that it went through, and it loses elasticity, and you start feeling the sagginess. And that can be proactively prevented by doing some of these non-surgical treatments. However, there are a lot of people who forget to do all these treatments, and then one fine day they go through this accelerated aging because they didn't take care of proactive management of their organ, the largest organ of their body, and then it starts messing with their psyche, and they go to a cosmetic surgeon, because that's when you go to a surgeon. If you let your skin go for far too long, at that point we will have to send you to a surgeon, and they will cut away the failed parts of your skin and then sew you back together, and then you will have to go back to these non-surgical procedures. However, I tell people that surgical facelift you might need once in your lifetime, but non-surgical facelifts you need every year. And sometimes as you get older, you might need non-surgical facelifts twice or thrice a year. And it's completely reasonable to get them done. The only unfortunate part is that chronic skin failure treatment is still considered cosmetic in United States, because they think that skin failure is not important and it is an out-of-pocket expense. I'm sure at some point this perception of handling skin failure will change, and a lot more doctors will take chronic skin failure seriously and its impact on human psyche seriously, and it will improve our lifespan, and it will improve our perception of ourselves. How much does a non-surgical facelift typically cost compared to a surgical facelift? So surgical facelift, if you are in United States, it will cost you, if you do like a full facelift including your neck and jawline, if you go to there are newbie surgeons, there are middle tier surgeons, and there are like top tier surgeons. If you go to a top shelf surgeon, you're looking at like maybe $100,000 for the whole face. It's like taking out a mortgage. If you go to a middle tier one, it's going to cost you like at least $50,000. If you do just a half a facelift and you go to a surgeon who's not going to botch you, you may still end up spending around $20,000 to $25,000. And so that's a surgical. So surgical facelifts should be reserved for those people whose skin has failed, and they have like lost the structure, the architecture, and it's like completely sagging. Sometimes that happens when you lose a lot of weight. But non-surgical facelift, which is like Ultherapy, or which could be, some of these other injectables plus Ultherapy, will cost you roughly around between $3,000 to $5,000 depending upon where you go. So if you're getting Ultherapy in Manhattan, you may end up paying between $5,000 to $7,000 for somebody who does it correctly and well, and who's experienced, who's not going to botch you, who does it all the way through for the year. And that is something every year. So I know it's expensive, but guess what? Your skin is expensive. That's why I call it the most expensive organ. Ultherapy is very suitable for pretty much, I've used it on pretty much every skin type, and I still have to find somebody who didn't get a good result, because it's just an amazing treatment. And it's the sound energy that Ultherapy brings to you is those frequencies are French frequencies, and I like the French. The French know how to tie a bag, and they know how to do it the best. And there are Chinese frequencies. It's called, they are in a machine. If you use a machine called HIFU, that's Chinese frequencies. If you use a soft wave, that is an American frequency, but again, they are not the same size, the same depth as the one that the French have. And guys, I think that French know beauty better than the Americans. No offense, but that's the truth. How can you describe the sensation during an therapy session? So a therapy session, what it feels like it feels as if a hot rubber band is striking against your skin. So it can be painful for people, and that's the reason that I like to medicate people before I give them Ultherapy. And for myself, I give myself an ibuprofen 800 milligrams, and that does it for me. But still, certain areas hurt a little more. And the best thing about Ultherapy is that after I'm done, it doesn't hurt. Like, there is no sign, there's no downtime. The best thing about non-surgical treatments is that there is no downtime, and we live in a very fast world now. The world has become really fast, and nobody has like 3 or 4 weeks of downtime. Do you have any facials for getting rid of sun damage? So the facials that I recommend for sun damage is laser facials, and laser is a very important treatment that normally we start from next month. So after Labor Day is over, we start our laser specials. Labor Day is the start of our laser specials. So that's when we start doing the laser. So laser is basically a light treatment. It's a frequency of light which basically disintegrates the pigment that is collecting under your skin, which collects because of the rays of sun. So the sun is not our friend. Guys, please remember, sun is not your friend. Sun is good for you. It is good for you, but we have a toxic relationship with the sun. We like it, we love it, but it's not good for our skin. We can only have like a quick session with the sun, get our energy, let our hair absorb its energy, and we get out of its way. Because the rays of sun, some of the rays of sun, they can damage the particles of your skin at a very deep level. And by the time that damage appears to you on the surface of your skin, it has probably been there for like months before it starts showing on the surface, because the rays of sun go through your skin into the deeper parts, and they damage the baby layers that are always growing. Because remember, your skin is like a 1,000-layer crepe, and usually the damage occurs in the lower levels, and every month there is a new layer of skin that comes up and then sheds away. So by the time you start noticing patches of sun on your skin or anywhere, that damage has been occurring for a long time. It may have happened 8, 9, 10 months ago, but now it's appearing. So one of the things that I am very particular about is that I want all my clients not to undergo any laser treatments throughout the year. The only time we open our lasers for pigmentation removal, sun damage removal, age spot removal, like our CO2 lasers or our plasma lasers or our Cyton, all those lasers, we basically park them for the whole year and we take them out after Labor Day. And because not only we don't want you to be exposed to too much sun after a laser treatment, but also we don't want you to be exposed to too much heat, because after we do a laser treatment on your face, your skin is not only sensitized to the rays of sun, but also to the temperatures. So we want you to be in like a very cool and cold temperature when you are resurfacing and removing the pigmentation. And that's my favorite facial for sun damage removal. And especially if you're a fair person, you should definitely try our laser facials. And the other facials, we have like regular facials too. We have like a glass skin facial, which is a combination of 2 facials, which removes the dead skin layers. And then we also put like moisture and other things back into your skin so that it has a glow and your skin appears glassy and glowy and fresh and young and luscious. Yeah, sometimes the when we remove the dead skin, it may remove some damage, but usually the sun damage and pigmentation that occurs, it occurs in the lower layers of your skin, so we need to do like a light treatment to remove it. It's very hard to remove it like that. I think I answered several questions, but so I will do it again. Bye bye, take care, see you.